And so ultimately, that's what root cause medicine is. You can see on the tree on the left here, the top is really these disease processes and how it presents, whether it's fatigue, brain fog, diabetes, even thyroid issues. But truly, what's at the bottom, and that's what we have to ask, is it because maybe you have hormone issues, low testosterone or low estrogen? Maybe it's because you have nutritional deficiencies. Maybe it's all these toxins that's in our world that could be causing insulin resistance and diabetes, or maybe it's because of really gut issues. So whether it's natural, conventional, Eastern, Western, we use whole person care to address the root cause. And we ultimately, again, ask the question, why is this going on? Right. And so Marianne here said, ultimately, root cause and healing patients from within while relying on natural solutions first. And so again, that's most of what our patients actually say about our approach that way. And so ultimately, if you think you've really been struggling with diabetes, this is probably why, because you think diabetes is only about sugar intake, right? We think medication is the only option. We've really tried calorie counting, exercise, and you still can't lose weight. Maybe you were told your hormones are imbalanced, but no one told you that actually hormones and actually stress actually affect blood sugar. Maybe actually you're not sleeping well, and that could also be actually worsening your blood sugar as well. And so all of these things could actually be why we're actually struggling. And so this is what I was doing when I was practicing internal medicine the hard way, which is what we've been doing it for the past 50 years. You go to your primary care doctor, right? And you complain of fatigue, brain fog, maybe frequent urination. They spend 15 minutes with you and they order labs, and I'll say, see you in 3 months. 3 months later, you go back and he says, okay, you're pre-diabetic. Tells you to eat less sugar, maybe exercise more, and then return again in 6 months to a year. A year later, now you're actually diabetic. Your A1C has gone up because you're really confused on what to eat without proper guidance. You go back to your doctor who gives you metformin, sends you to other specialists like podiatry, ophthalmology, which is eye doctors, but your fatigue and your weight gain continues to worsen. Other labs become abnormal, like your cholesterol gets elevated. Your A1C doesn't seem to improve, besides now taking metformin, adding another medication on as well. And then now you actually start getting some neuropathy, numbness, and tingling in your feet, maybe blurry vision, and then you're really scared of what could happen because someone in your community with diabetes actually just got a heart attack. And so now your provider starts scaring you and saying, hey, maybe you need to actually get on insulin. And so the end result ultimately is same symptoms in the beginning with no relief, no answers, and ultimately your health does not improve. So how many can actually relate to this story? If you guys can you please put a one in the chat? I'd love to um, get feedback that way because again, we see this day in, day out. And again, that's why unfortunately we're seeing more diabetes being diagnosed and not really seeing the best results that we can. Steve and T, yes, Mike, I think again, this is a typical case, if not even like worse, and maybe not even a year in those cases. So that's the hard way. Okay. And I'm going to talk about our alternative way as well. And so Erica just said again here, how he got down to the root cause of how my body was functioning. The integrative tests actually lay out how your individual body is ticking. So again, trying to get down to the root cause that way.